pumanaw na rin ang unang kaso ng COVID-19 sa Visayas.
The DOH also recorded 222 fatalities, bringing the total death toll to 33,330.
Hospital ng Quezon Medical Center, biglang dumami ang mga nasawi sa COVID-19 pagpasok ng buwan ng Setyembre.
Samantala, 13 naman ang nadagdag sa bilang ng mga nasawi o kabuang 3,010.
Namatay ang kuya ni Jerry pagkalipas ng isang linggo. Pero mukhamang COVID-19, hindi nila agad nalaman ito.
The coronavirus has killed more than 770,000 Americans based on last year's figures. Almost 15,000 more have died from COVID-19 in 2021.
Coronavirus deaths in Eastern Europe topped 1 million on Thursday as the Omicron variant threatened to batter the region.
Official statistics suggest that the virus has claimed around 3 million lives. But a statistical model created by The Economist calculates the number to be more than triple that.
COVID had done a lot of damage in our lives in the past 2 years. Everyone had already experienced the worst of this pandemic. I, myself, didn't have the chance to save myself from being infected. I was tested positive last September of 2021, and to be honest, it's not that easy. I fought hard for this virus.
The new strain of coronavirus was first reported in Wuhan, China in December 2019. It is named COVID-19. Coronaviruses are family of viruses that can cause respiratory illness in humans. It is found in bats, cats, and camels. COVID-19 enters your body through your nose, mouth, and eyes. The most common symptoms are fever, cough, tiredness, and loss of taste or smell. Less common symptoms are sore throat, headache, ache and pain, diarrhea, a rash on skin, and red or irritated eyes. And the serious symptoms are difficulty breathing or shortness of breath, loss of speech or mobility, and chest pain. The Department of Health today, January 30, 2020, confirmed that a 38-year-old female Chinese patient under investigation is positive for a novel coronavirus. DOH, however, continued to guarantee the public that all necessary precautionary measures are being taken to halt the spread of the virus. This is Hazel Pabrical reporting. One thing we know for sure about COVID-19 is that it's changing constantly. This mutation creates new variants of virus including Alpha, Beta, Delta, and Omicron. Sometimes the variants are less contagious, less severe, or have slightly different presenting symptoms. Here in the Philippines, COVID-19 cases is continually increasing. Ms. Hara from DOH will share important information on how we can protect ourselves from the virus.
I'm Hara. Here are some precautions that we should remember in this time of pandemic. Let's start with what you should do. First, stay at home whenever possible. Second, wash your hands or use alcohol. Third, wear a mask when you go out of your house. Fourth, stay at least 6 feet away from people when you go out. And on our last number, if you feel sick, please stay at home. Now that you know the right things to do, let us now proceed with the things that you need to avoid. Number 1, don't take medicines that you haven't been prescribed. Number 2, do not visit friends and family members who are infected with COVID. Number 3, don't go to crowded locations like parks and beaches. Number 4, don't use others' personal belongings. With this in mind, you can now avoid being infected with COVID-19.
Live from Department of Health, Ms. Abag will show us the proper way of washing hands as it is one of the precautions to slow down the spread of the virus.
I'm Ms. Abag from DOH, so we're going to talk about the importance of hand washing. So, one of the best ways to keep you from getting sick is to hand your wash often. Proper washing hands keep you harmful germs you've touched from getting into your eyes, nose, and mouth, and keeps you from spreading harmful germs to others.
So this is the simplest ways to wash your hands. So first, wet your hands with a clean running water. And turn off the taps and put soap on them and lathers them together. Make sure to don't forget the back of your hands between your fingers and under your nails. Lather for at least 20 seconds. Then, when you're done, rinse them well under clean running water. And then dry them with a clean towel or air drying, but we don't have that. You can use the tissue. So that's all. The simple practice of washing your hands is the easiest way to lower anyone's risk of illness. So wash your hands often.
I needed to be monitored 24/7 because I already have difficulties in breathing. And there's this one night where I stopped breathing while I'm asleep. I fought one of the COVID-19 serious symptoms.
I'm Katrina A. De Leon and I'm here to give you information about COVID-19 vaccines in the Philippines. The rollout for the Philippines National Vaccine Program began on March 1, 2021, shortly after the arrival of 600,000 doses of Sinovac vaccine. Philippine General Hospital Director and Dr. Gerardo Legaspi officially became the first recipient of a COVID-19 vaccine in the country. The initial batch will cover 50,000 military personnel and 250,000 health workers. The Philippines also began vaccinating children aged 5 to 11 against COVID-19 on February 7, 2022, after initial hiccups over delayed deliveries of Pfizer-BioNTech doses and opposition to the drive by some parents. What are the vaccines available in the Philippines? There are varieties of vaccines approved by FDA such as Pfizer-BioNTech, Oxford-AstraZeneca, Sinovac, Sputnik V, Janssen, Covaxin, Moderna, Sinopharm BIBP, Sputnik Light, and Novavax. As of February 28, 2022, 135,747,294 total vaccine doses have been administered throughout the country, with 63,219,221 being fully vaccinated and 10,214,164 booster doses administered. Now let us know what are the benefits of getting COVID-19 vaccine. Number 1, the vaccine reduces your risk of infection. Once you receive your first shot, your body begins producing antibodies to the coronavirus. These antibodies help your immune system fight the virus if you happen to be exposed. So it reduces your chance of getting the disease. Number 2, the vaccine protects against severe illness. During studies, the 3 vaccines, Johnson & Johnson, Moderna, and Pfizer, have shown to be effective at preventing severe illness from COVID-19. So if you are vaccinated and become infected, you are very unlikely to become severely ill. Getting vaccinated could save your life. COVID-19 vaccines provide strong protection against serious illness, hospitalization, and death. There is also some evidence that being vaccinated will make it less likely that you will pass the virus on to the others, which means your decision to get the vaccine also protects those around you.
Through this video, we are asking all of you to take care of your health and help to stop the spread of the COVID-19 to save lives. There is now real hope that vaccine will help to end this pandemic. But until it is over, we must stay vigilant and continue to protect our loved ones by wearing face masks, physically distancing, washing our hands, and continue to follow the other COVID-19 precautions. Together with our government and health worker, we are one against COVID-19.